Hello and welcome to the 56th Bi-Monthly Breastfeeding Coalition's webinar. I'm Kimarie Banerjee, the Senior Manager of Coalitions Relations at USBC, and I'm so glad to have you join us today. As you know, this series is jointly hosted by CDC's Division of Nutrition, Physical Activity and Obesity, and by the USBC. The webinars, referred to as the 222, are held on the second Tuesday of the month from 2 to 3 p.m. Eastern. And the purpose of this series is to highlight the work of breastfeeding coalitions and our national member organizations and provide opportunities to network and collaborate on issues of state and national significance. So we alternate the sessions, bringing you highlights from state and local coalitions sometimes, as well as from our national initiatives. These webinars are free and access is open to all interested breastfeeding advocates from around the country. If you haven't already joined our Coalition's Learning Connection, you can join it, and all our announcements are received through the CLC, the Coalition Learning Connections. For this series, the topics are set up 2 weeks in advance, so you can know what the upcoming topics are. So as you might know, that starting spring of last year, to streamline the access, we've just done a registration for the entire series. So if you sign up even for one webinar, you're automatically signed up for the series. You get the announcements, you get reminders, and you also get the link about where the archives and the recordings are. So this prevents you from having to register for every single session. We know that it's not possible for folks to listen to these webinars live always, since it's in the middle of the working day. So you will be able to, all these sessions are recorded and archived, and you can access them at your convenience. So to access any of the past sessions, you can go to www.usbreastfeeding.org/webinars, and I'll show you where you can get it. So if you go to our homepage, www.usbreastfeeding.org, across the top, you'll see the different tabs. Click on the coalitions, and you'll see all our webinar series, the CDC-USBC. Click on that, and it'll take you to the page with all the handouts and the session materials of this one as well as the last ones. So just a little housekeeping. For today's sessions, all participants are in listen-only mode. We have 600 folks registered for this session, and we are very excited to have you all participating in this. We hope to have a very robust question and answer session. And we set aside about 15 minutes for questions at the end, but you can write your questions at any time and type them into the question box. And here's how you do it. In your control panel on the right, you should see a tab called Questions. If you don't see a control panel, it might have been minimized. Just click on that orange tab with the white button, and it'll pop back out. Scroll down to where there's a tab for questions. Click on it, and it'll open a text box for you to write down your questions, and we will pass them on to our presenters. If you have any tech problems, audio issues today, send an email to coalitions@usbreastfeeding.org, and our staff will do their best to help you. And for today, in lieu of our regional calls today, we will continue the webinar session for a second hour to present important USBC updates for coalitions. And the updates session will also be recorded. So for those of you who might not be able to stay on for 2 hours, this extra session will be available to you later today as a recording. And that brings me to today's session, the community in CHAMPS. Reaching Our Sisters Everywhere, or ROSE as it's called, is among the valuable partners involved in the communities and hospitals advancing maternity practices, the CHAMPS initiative. And This initiative focuses on improving maternal and child health outcomes through promoting breastfeeding-friendly practices among hospitals in New Orleans, Mississippi, Southern Texas, and Southern Tennessee. Rose's involvement addresses community engagement and empowerment through its Community Transformer Breastfeeding Peer Support Program. Today's session will highlight the achievements accomplished in this area and also give us a sneak peek at the additional activities to come. So for those of you who might not be familiar with the important work that Rose does, Rose is a nonprofit developed to address breastfeeding disparities in the African American community. Rose's mission is to train healthcare providers and community organizations to provide culturally appropriate encouragement, support, and clinical care so that African American mothers will breastfeed at higher rates and sustain their breastfeeding experience to match the goals expected by the Surgeon General of the U.S. So I am delighted to introduce our presenters. Kimarie Bugg is the Chief Empowerment Officer, CEO, and change leader of Rose. She has worked in pediatric emergency clinics, special care nurseries, been a bedside breastfeeding counselor in a large hospital. She's managed perinatal and breastfeeding programs at the state level. Ms. Bugg has served as a technical advisor to Best Start as well as for the U.S. Baby Friendly Hospital Initiative. She was a founding member of the Georgia Breastfeeding Task Force as well as the Southeastern Lactation Consultants Association, SELCA. Kim was trained at WellStart International and has traveled throughout the U.S. and several foreign countries training healthcare professionals to manage lactation. Kim previously worked for Emory University School of Medicine as a nurse practitioner. She's a member of the national faculty for NICHQ, the Best Fed Beginnings Baby Friendly Hospital Initiative. She provides training for WIC staff. She completed a health leadership programs with the Satcher Health Leadership Institute at the Morehouse School of Medicine and subscribes to the Satcher Health Leadership motto that in order to eliminate disparities in health, we must have leaders who care enough, know enough, and have the courage to do enough, and who will persevere until the job is done. I can say personally that Kim exemplifies that. She served on the board of USBC, and with her guidance, the USBC Equity Committee was created in 2013. She continues to guide USBC's work. Our second presenter is Andrea Serena, who is the program manager at Rose. Andrea is a passionate breastfeeding advocate originally from North Hollywood, California, where she attended Mount St. Mary's College with a major in healthcare policy and a minor in business administration. Involving the work of grassroots in policy has been her main focus, and her work has emphasized community engagement and resilience. Andrea has helped lead a number of breastfeeding awareness movements through the use of social media. She assists in the planning and coordination of Rose's annual summits, and Andrea serves on USBC's equity and advocacy committees, and her leadership and insights are invaluable to us. And with that, I am going to turn it over to Ms. Kim Bugg. Kim, you might be muted.
Good afternoon, everyone. Andrea and I are very honored to be here with you this afternoon, especially to be able to discuss with you, share with you, and talk to you, get your questions and comments and concerns about this really great program that is going on in several southeastern states. CHAMPS, Communities and Hospitals Advancing Maternity Practices. So the CHAMPS program has been funded by a grant from W.K. Kellogg Foundation. It's a 3-year grant and this is the second year. We're in the second year currently. Ann Merwood is the CHAMPS project director. She is stationed in Boston at Boston Medical Center, and I am officially the CHAMPS community engagement director. One of the things that Ann and I did, we worked together on the Best Fed initiative, and we have brought several of the lessons learned from that wonderful initiative along with us to the CHAMPS initiative. And one of the main things that we learned in Best Fed, and they did incorporate, was that from the very beginning it's necessary to also include the community. We sort of found out halfway through that we were doing wonderful job at preparing the hospitals, preparing prenatal clinicians for what to expect when they got to the hospitals, but we didn't realize that we also at that time needed to make sure that parents too were prepared and had some anticipatory guidance. So the objectives of the CHAMPS program is to decrease racial disparities in breastfeeding and maternal child health care, to increase exclusive breastfeeding rates in the South, to enroll at least 25 hospitals located in Mississippi, specifically the New Orleans area and southern Texas. We were also allowed to work with a couple of hospitals in the Memphis area because several people from Mississippi tend to travel to Memphis area to deliver. So we were really happy to be able to also incorporate Memphis area, and we have some wonderful hospitals that we are working with in that area, and also public health has come along. We also, to help at least 10 of those hospitals to become designated baby friendly, and to improve maternal child health practices in all 25 of the hospitals. So thus far, the enrolled hospitals are 31, so we have already exceeded the 25. Of those 31 hospitals, 16 of them are located in Mississippi, 8 are located in New Orleans, 5 are in Texas, and we've enrolled 2 hospitals that are in Tennessee. 21 hospitals are on the baby-friendly pathway, and 2 additional hospitals are ready to get started on the pathway. So I'm sure you all are very familiar with the hospital pathways. And in this initiative, we currently have 6 hospitals that are in the discovery phase. There are 7 hospitals that are in development. There are 5 hospitals that are in dissemination. And currently, 3 hospitals are in the designation phase. So what are the benefits of the CHAMPS program? Those include access to experts from around the country. I am really proud to be a member of a team that is really pretty phenomenal. There are data experts and community experts and training experts and, of course, physician experts, all included as part of the expert team that was put together to work with the hospitals in these particular areas. There are people from all over the country, and we're also working with specific champions in each one of these states to also help advance this initiative. Strategic and practical help with changing hospital policies and practices, We also help with charting needs related to breastfeeding, access to clinician resources, one-on-one technical support, and collaborative environment with other hospitals. We, again, ask that they will share information with each other as they are on this journey together as much as possible. So what is expected from CHAMPS is that the hospitals create a task force of committed practitioners and decision makers. And on these committees, we like to, for them to also include parent participation, to work collaboratively with the community to link resources and address the needs of breastfeeding families. Also to collect data on breastfeeding rates, skin to skin, rooming in, and also racial data, to also collect that for us too. So some events that CHAMPS has done thus far is a couple of regional conferences. There was a conference done in Mississippi Delta, in Greenwood, Mississippi. There was one that was in New Orleans area, and just very recently, one in Jackson, Mississippi. In all of these workshops or conferences, summits, healthcare providers, including physicians, administrators, nurses, and also the community were all involved and had a say in the summit. We wanted to be sure that time was made in each one of these for the community to speak and also for healthcare providers to speak to what their concerns were about moving forward with this particular initiative. We've also completed a couple of Blue Cross Blue Shield regional baby-friendly conferences. Blue Cross Blue Shield in Mississippi is working very diligently with every hospital that delivers babies to help them and guide them through the baby-friendly hospital initiative. They're doing a phenomenal job at making sure that all of the hospitals will come on board and really work on maternal practices. In Mississippi, we also have worked with the Mississippi Perinatal Quality Collaborative initiative, and that is a phenomenal initiative of intra-professionals from throughout the state that are working on several initiatives, the Baby Friendly Hospital Initiative, along with several on infant mortality, maternal concerns, and many others. So we've participated the last 2 years, 2014 and 2015, with that collaborative, and they are doing some really great things in Mississippi, and we're really proud to be a part of that with the CHAMPS project. So a couple of other things that are going on is Wednesday webinars in collaboration with the Mississippi Department of Health, and those are all online. We've also hosted several webinars, and those are online. Have 5 more scheduled for 2016, which will include working with physicians, how to impact prenatal care, and several others. And as I mentioned, all of these are recorded. So a couple of other events that we're doing with CHAMPS is a 15-hour training has been completed at a hospital in New Orleans with a couple of consultants, and there were probably 45 nurses that were trained in that initiative. One of the things that has been brought to our attention is that it costs for staff to be off and to be trained. And so we've worked with the hospitals that we're involved with to make sure that they are able to get the information and the education that is needed in a timely fashion, and definitely evidence-based training. One of our favorite things to do is a 4-hour clinical skills training. There was a curriculum that was put together, and the curriculum is 4 hours, and we go over all of the things. In this particular 4-hour clinical training is for nurses. So thus far, 15 of these trainings have been completed in Tennessee, Mississippi, Louisiana, and over 250 clinicians from the community and the hospitals have been trained. And so in January, we've actually started the trainer initiative. And the reason for this is so that we can assure that there are trainers in place to complete and continue the training after the hospitals get on this pathway, and as new employees are added to the rosters, that the training can continue. So the upcoming, there are going to be about 5 trainings coming up where we will also be doing train the trainer courses. So I wanted to just share some images of a few of the trainings that we have done recently. And what we have made sure that we've done in each one of these trainings is to include a parent panel, as you will see here. And every time, it has not failed. Each one of these times we have done this, we have had administrators especially come up to us and say how their feelings were hurt because of what the mothers said about their care in the hospitals where they delivered, where they were administrate. They were very concerned that, things happened, and, folks would say to moms things like, do you want your baby or do you want to sleep? That's sort of one of the favorite sayings that was going on in most hospitals. And so these mothers, who were all breastfeeding mothers, talked about their struggles, how difficult it was to get out of the hospital successfully breastfeeding. That was worth thousands and thousands of words that we could have said to these administrators most of the time, to actually get it from the moms from their own community that delivered in their own hospital. So we have included that in each one of the sessions that we do, and that is one of the major highlights. So the rooms have been configured in all kinds of different ways, to really long rooms to really huge rooms, and these are all nurses. And when we started out, a lot of times it was very difficult usually in the beginning for the nurses to relax and to open up. But as a nurse, and I always call them my tribe, to allow them to understand that, we know where they're coming from, because as a nurse, I was not trained in lactation management either, and that's okay. That we're smart enough, we can figure out anatomy and physiology and biostatistics, that we really could do this. And so by the end of the session, most folks were really learning and happy to learn, and smiling and really excited about going forward with learning and helping moms. We talk a lot about in our sessions about how to talk to moms, because one of the things that I used to get so much as a woman of color when I traveled throughout the country doing hospital mock assessments is, how do we talk to these women? And so that was one of my questions that I love to get. And so we did a lot of counseling on how to talk to all women in general with respect and with integrity, and to respect and be a good listener most of all. So we talk a lot about the difference in equality and the difference in equity. It's important that we level the playing field, especially when we're talking about counseling and working with and encouraging women of color to sign up for this program. So those are some of the topics that are included in our 4-hour discussions. We make sure that we get demonstrations, that we do a lot of role playing, because these are not skills that have been taught, and a lot of young nurses or nurses in the hospitals in the areas where we are have not seen these skills modeled. So you'll see here, this is a table, and Emily is the one who would get up on the table and be a mother in the bed. That was not something that me, Kimarie, would not do. I stayed on the floor, but Emily would get up there, and we'd have the staff nurses come up and work with her and help her to position, help her to latch, and she was just an excellent role model mom to really get them involved in what was going on. And then we'd also do a lot of hands-on and have them teach each other different skills also, and then check them off. So now I am going to turn it over to Andrea.
Thank you, Ms. Bugg. Hi, everyone. So I'm going to give everyone a little more insight on the community transformers that are involved in the CHAMPS project. And so here we have pictured in our top left, those are some of the community transformers in New Orleans. And then moving on over to the top right, those are some ladies in Jackson, Mississippi that we trained. And in the lower right, those are another set of ladies that we trained in Jackson, Mississippi, so we went to Jackson twice. And then in the lower left-hand corner, we have pictures from ladies that we were training in Memphis, Tennessee. So in total, we have 53 community transformers that serve the CHAMPS areas out of the 111 Rose community transformers that we have in total across the U.S. And so these ladies, they do a tremendous job at really being a part of the available resources that are there within their community. And so in order for the ladies to become community transformers, we always reach out, and we reach out by identifying partners in each of the states that we're getting ready to host a community transformer training. And we get moms referred, and we put the information on social media. We email past community transformers and ask them if they know any moms that would be interested in coming to the training. Once they go ahead and apply and go through the process, we vet, for moms that have had some positive experience with, the overall positive experience with breastfeeding and that have breastfed for at least 6 months in the past 5 years. Upon doing the vetting process, we invite them to come to the 2-day training, and there, during the 2-day training, we go over evidence-based information regarding breastfeeding, the history of breastfeeding, 3-step counseling, we do role plays, so that way the moms can feel more comfortable in doing that peer-to-peer support. The following day, we go over ways that they can contribute to their community by hosting some breastfeeding clubs and going over information on how we will continue to be there as support and resource. And one of the key things in our community transformer trainings is it's not just us ladies who are doing the training coming in from Rose, but we also make sure that our partners are in the room as well, because our community transformers need to be able to identify and see local resources that are there to also help them be these community advocates. One of the things that we want our community transformers to serve as are local and accessible support, in that a mom who may deliver, she knows that, Darsha that lives 2 doors down, knows something about breastfeeding, that she can go ask her for some help. Or that having a breastfeeding club, there might be one at the local library, the local bakery, that they've seen the sign that they can go to, and it's easy for them to get to. They don't have to go 2 cities down to get access to support, and that the person that they're getting support from could be someone they know already. And then the thing about leading the breastfeeding clubs is we don't want to have a session where, you know, the ladies are teaching, but instead have a conversation with the moms as a mommy meetup, so that way we can discuss breastfeeding experiences, we can knock down some myths, and then relationships can further be strengthened. So that way, you know, when a 2, 3 o'clock in the morning issue comes up, they know that they can feel comfortable calling, you know, another mom that they've met inside their breastfeeding club. And so our breastfeeding clubs are geared towards serving not only addressing initiation, but also duration, and that when they happen in a frequency where they can go every month, or depending on how available the community transformer is, that each meeting that they can go to can contribute to their duration in breastfeeding. And also to make sure that our community transformers serve as community advocates, because they know what is going on in their local community, what barriers they are facing. And some of the trainings, we have learned some tremendous and great information regarding barriers that our community transformers have faced within their community. And these are things that we're able to kind of take back and help in addressing the larger picture and making sure breastfeeding access is equitable. So why community transformers? As Ms. Bugg started off, you know, she said that some of the lessons learned from, you know, the initial initiative she was a part of was the fact that the community needed to be taken along in this process, and that you can't do things to the community, you must do things with the community, and making sure that the community is a part of this process. And so that community transformers, you know, we kind of go through the 10 steps and some of the changes that the hospital might be going through as a part of this CHAMPS initiative, so that way they can relay this information to the moms that they interact with and work with, and let them know that they might experience some skin to skin, you know, with the baby coming straight onto the chest, and why pacifiers may not be immediately available, and, you know, why the baths may not happen right away, that this is something that they get a little insight on before delivery, that this is a conversation that can happen prior to. And then just along the way, because one of the things that are part of the 10 steps is having available community resources upon discharge. And so that way these community transformers can be a part of that resource list for those hospitals going through the baby-friendly hospital initiative and a part of CHAMPS. And so in advancing change, some of the things that we are able to achieve with the community transformers within the CHAMPS initiative is that the community transformers are being trained in areas that are next to hospitals, going through the policy changes to be in line with the baby-friendly hospital designation. And so with that, because, you know, you have hospitals that will have to refer out to community partners, it's easy for us to help make that connection between the community transformers that are in that local community and the hospitals going through the designated process. So that way they could, you know, some of our community transformers have been able to lead the breastfeeding clubs at the hospital going through some of these policy changes, and even we prefer that, you know, the breastfeeding clubs happen outside the hospital. But if that is what is accessible, and that's what the community transformer deems as what can really help and support their community, we take it because they know their community best. And so, like I said previously, having the community transformers also educate on the 10 steps really help to, once again, be that anticipatory guidance for moms through the process of, you know, their delivery. And even if that hospital isn't baby-friendly, designated baby-friendly, then some of their policies may have changed to be in line. And it is always important that, you know, from a peer-to-peer aspect, that you can hear about the importance of breastfeeding. Generally, you could talk about breastfeeding. People know breastfeeding is good, but it's important that we educate on the importance of breastfeeding and highlighting things about breastfeeding that some moms may not have known, and that is to help work towards that initiation and duration. With our breastfeeding clubs, the breastfeeding clubs are to be led by community transformers, and as previously stated, it's supposed to be a mommy's meetup. And so when we go through our training regarding, the breastfeeding clubs, we discuss that each breastfeeding club should have its own topic, whether that topic might be, what's your favorite position, and then using that as an opportunity to discuss some of the other positions that are available, to talk about breastfeeding myths, and, just allow that conversation to go. So that way it's not only a sociable time, but also a time to learn some great information. And so our ladies, as they go through the community transformer training, they get tons of resources. They get a manual to help lead the breastfeeding clubs, and are provided with additional information that they will need to help disseminate evidence-based information on breastfeeding. And once again, breastfeeding clubs are there to establish, the relationships among the ladies that are attending. Now, before I go into this lovely picture, one thing I really want to highlight is that the our community transformer breastfeeding peer counselors, this is not their job. Okay, being a Rose Community Transformer is because they are passionate about breastfeeding, whether they had an excellent experience or a challenging experience, and they want to make sure that the next mom that they meet can overcome challenges, and they can have somebody to call and be their support. Because I don't know how many times I've heard the moms say during their trainings that I didn't have anyone to call, and I didn't like feeling alone. And so that may be their fire that got them to sign up for the Community Transformer training, or some of them have said, oh, this one person I was able to call and get help from, and she was a Rose Community Transformer, or she was someone that I seen that motivated me. And so not all community transformers are going to run off and start breastfeeding clubs. And what's important is that they have the knowledge and information, and that they are even able to assist their sister, their cousin, their niece, people in their community. Just having the accessible resource there is what's important. So that way we can kind of move away from, I've never heard that. This is information that's never been around and no one's ever told me. And we can change that dialogue to, oh, someone next door was able to give me great information, or I was in the store and this lady, stopped me and we had a talk about breastfeeding. So this is not a job, but we go ahead and provide an opportunity for our community transformers to report on any outreach that they have done, their breastfeeding clubs, any one-on-ones, and so that way any community transformers that are interested in taking this passion to support moms of breastfeeding to additional levels can have access to the data and the outreach that they have done. So the monthly report that we designed is accessible for them to complete on their mobile device, on a phone, computer, whatever they have access to. And so with this, when they're able to, because some of them don't all have computers, and so once they are able to, get this in, when they submit it, they get a copy of everything that they have submitted to us. And I have heard many of our community transformers who, came to the training, they decided that this was something they were super passionate about, and they went on and sought out to be a CLC. In fact, we've had some community transformers that not only went out to become CLC, but have participated in our IBCLC prep course, because that is something they want to go and do further. And so this opportunity to see their impact is what's important. And like I said, because the Rose Community Transformer Program is not a job, we take whatever they are able to do, whatever outreach they are able to achieve, whoever they were able to talk to, whether it is another daycare, whether it's a library, whether it's a group they went to, a health fair they participated in, and we applaud their efforts, because it really means a lot that they take the time out of their day while dealing with children, going back to work, going back to school, and to continue to be a resource for their own community. So the next steps, as we gear in with CHAMPS and with Rose Community Transformers, is to continue the guidance in establishing breastfeeding clubs as local resources. One of the things that we do with our Rose Community Transformers is we have a closed group for them on Facebook where we're able to continue to engage on a month-to-month basis. This is their safe space to provide questions, to talk about concerns, challenges that they're facing, or accomplishments that they have made, or to even just share other breastfeeding news. And so with that, we're able to continue to cultivate the relationship, because that's what all this is based on, is building relationships among each other and support among each other. We'll continue to promote breastfeeding clubs as they come. You know, when a community transformer, when they decide that they are ready to do breastfeeding clubs, they create the flyer, and we'll share it on our social media. We'll put it on our website. And then we'll continue to collect community transformer data on outreach and, you know, the people that they have touched, the organizations that they may have collaborated with, because RCTs, you know, as we talk to them and as we continue our relationship, has shared some phenomenal stories, whether it is a hangout video that they did with a mom or, you know, doing a breastfeeding club at a store, boutique, or a bakery. It's just been phenomenal to hear the work, and that's often not put at a microphone to be voiced.
So that sort of concludes our prepared presentation, and we are very willing now to take any of your questions.
Great. Thank you so much, Kim and Andrea, for such a terrific presentation and for showing us how vital it is that communities be equal partners with healthcare and public health if we're going to have, you know, successful initiation and duration. So one question we have here is, how can folks who are not in the CHAMPS program have access to some of the webinars or trainings that you have? Is it possible for folks to do that?
Well, I believe the webinars on the CHAMPS website is open to anyone who may want to view, even if they're not in the CHAMPS designated area. So that is, you know, go to champsbreastfeeding.org. I'm going to say it again, champsbreastfeeding.org.
Just champsbreastfeed.org,
yeah,
I believe,
okay. Yeah. To visit the website and, you know, stay on top of some of the webinars. With our community transformers, those trainings, those are hours that we do, and because of, you know, funding with CHAMPS, are the community transformer trainings that we have done outside of the CHAMPS area has because of other funding and grants that we have. So it's funds that support those community transformer trainings.
Right, and this just shows how important it is for this kind of training to be really spread across other states in the U.S. as well. So how about what were some of the issues, any issues faced with involving parent partners in terms of scheduling time to meet with them, or, you know, engaging them in the work which pulls them from their family? So with other states focusing on peer support, and how were some of these challenges that you met with when you started your breastfeeding club and your transformer trainings?
Well, I guess some of the concerns that, you know, many of the concerns that we heard is that especially women of color don't breastfeed. And so we were able to dispel that myth, and we have done these community transformer trainings in many other states also. And so it's just, again, it's just the education and the information on making sure that we are good listeners, and that we are respectful, and that equity also matters. And as we continue to say that, folks have just realized that it really is easy, and every mother wants the best for her baby. And, you know, again, it's just gotten a bit easier and a bit easier because of social media, because of so many wonderful young women out there willing to share with their cousins and their aunties. And in fact, you know, we're hearing so much now, you know, so this has been a concern, this has been a problem as we travel, because so many people are much more used to seeing other women breastfeed.
And to piggyback off of Ms. Bugg's statements, you know, the importance of just creating the dialogue, because one of the questions we usually ask at the training is, you know, how many of you had your providers talk to you about breastfeeding? And the raised hands are usually low. There's really not that many that raise their hand as far as a provider giving into that dialogue to begin with. And so also meeting, you know, we meet our community transformers where they are. We go ahead and we find out from our partners, like, what are the best location, what's the best accessible location to do this training. That's what's important. And as far as the breastfeeding clubs, you know, one of the key things of why we have the small community transformers, because if we have moms that know, okay, in my area, a morning time breastfeeding club is not going to work, I need to have one on a weekend instead, where, you know, I know that, you know, moms in my areas will be able to attend. That is, instead of imposing, this is what we're going to do and this is when it's going to be offered, it's made available and directed by the community expert, the person that lives within the community, that knows their community best. And so it's important to have that conversation, that dialogue.
And Kenny, I also wanted to mention two other initiatives. One is Champion of the Week that CHAMPS sponsors, and that is anyone in the states that we're working in that has done something phenomenal in breastfeeding that week. So the champions of the week have been mothers, they've been physicians, lactation consultants, nurses, WIC staff, and it really highlights what they've done. And just even in the states where we are, you know, for example, in Mississippi, there are so many people who didn't know there were so many people out there doing good work. And so it's nice to introduce them to each other. And the second initiative is called Contenders, C-O-N, and then the T-E-N is capital, and then D-E-R-S. And the Contenders, as we mentioned, there are 10 hospitals that should be designated baby-friendly by the end of this initiative. And so the Contenders are the ones that have been identified by the group as those who will probably be those 10. And so we have more than 10 contenders, and we're really excited about that. And no, I can't tell y'all who they are.
Wonderful. And for those, if you get on the CHAMPS, like their email list and things, you can get the champion, the champion of the week announcement. It's very exciting to read about them and see that. So do make sure that you click on that website and subscribe to any announcements or emails that they are getting, very, very useful ones. Do you have, there was one question from a person who lives in one of the states, is there anything specific that, any of the big insurance like Blue Cross Blue Shield of Mississippi is offering to encourage hospitals who are in this process? Is there training, conferences, anything that you know of that, other states might be able to leverage?
Well, actually, they were one of the first that have done this, and there other states are definitely looking at what they're doing and sort of, you know how you do, let's see how successful this is going to be. So we're hoping that this is going to open up avenues for many more. One of the other things that we are seeing a lot of is that we are proposing that that we place baby cafes in these areas also that we're working in, so that they'll have other levels of support. There are, of course, the WIC support, there's La Leche support, there are community transformer support, and so now we are looking at sort of having clusters of baby cafes as another level, because we know that we need all the levels, the expert, the novice, everyone. And so that's something that we're looking forward to doing too, and starting baby cafes in Mississippi, Louisiana, and Texas.
Wonderful, thank you. And we have time for just two other questions. And one was that, can pregnant women come to your breastfeeding clubs too? So is it mostly for mamas, or is it for our pregnant women as well?
So for the breastfeeding clubs, yes, all are welcome, pregnant, breastfeeding, whoever is interested in coming to get information about breastfeeding. If you're talking about the community transformer training, though, If they're currently pregnant, that's fine as long as they have already achieved a history of breastfeeding for at least 6 months in the past 5 years. So, we've had moms come to our community transformer trainings who, were in fact pregnant, but they had a child previously. But for the breastfeeding clubs, yes, that is open.
Okay, thank you. And Kim, Andrea, either of you, how might, local coalitions help, better build relationships and trust with communities? Right now, our coalitions are very public health, healthcare centric, and many are working towards greater community engagement and inviting more folks from the community into their coalitions. But what did you see on the ground, and how might coalitions help?
We try every place that we go to involve the coalitions, and as you mentioned, what we find a lot of times is that it's pretty healthcare top heavy. And so a lot of, especially, young moms and moms of color don't feel at all welcome. And, it's also, the same thing with a lot of the breastfeeding support groups in the communities. They just felt that they didn't feel comfortable. And so that's why it's so important to just be open and be good listeners and not just, welcome, people of different ethnicities, people of different ages, all types of welcoming needs to be done in the coalitions, because again, we feel like, they tell us that, they're mostly nutritionists or mostly lactation consultants or, mostly nurses. And so it's just not an open, welcoming environment for them. And so that's why so many communities, are really trying to establish more support or breastfeeding clubs for in their local community, so they don't have to travel far also.
And just to piggyback off of that, even when we mention, the breastfeeding coalition, sometimes we guess there's a breastfeeding coalition, what's that? So of course, building that awareness that, the resource that a breastfeeding coalition is there is important, that the community knows that there is a breastfeeding coalition. Some of the questions that come up, amongst moms at our community transformer training is, the issue with going back to work and, breastfeeding break time and what to do and who to contact. And, that's the opportunity where I said it would be great to connect with, your local breastfeeding coalition. And that's when we realized that, many of them didn't even realize that there is such a thing as a breastfeeding coalition to begin with. So coalitions, it's important that works on the visibility of being involved in community initiatives that are taking place. Is there a health fair going on near you in the community? Do you have a table there? So that way you can dialogue and help, raise awareness about your existence. So that way moms know that you're a resource to go to.
Absolutely. Thank you. Lots of food for thought here and lots of work, that opportunities for coalitions as well. Community is an equal and vital part of this piece. And if the community is missing from our coalitions, we are not being able to get the impact that we need to make. So thank you again so much, Kim and Andrea. And it's now time for CDC updates, and I'm going to invite Air Chief of the DNPAO, Kelly Scanlon, to give us updates from CDC. Kelly, you're on.
Hi, we just have a few updates from CDC. First, some updates on baby-friendly technical assistance. The Best Bed Beginnings project was the cooperative agreement with the National Institute for Children's Health Quality. This is the project that ended in March of 2015, but the hospitals continue to receive baby-friendly designation. So as an update, as of January 15th of this year, 69 of the 89 best-fed beginning hospitals have been designated baby-friendly, and that increases the percent of infants born at hospitals providing optimal breastfeeding support to just over 16%, so double the Healthy People 2020 target. Empower is the current CDC initiative to assist hospitals to move towards baby-friendly designation, and it is Empower Enhancing Maternity Practices. It's a contract with APT Associates, and APT is working in partnership with the Carolina Global Breastfeeding Institute, the Center for Public Health Quality, and Baby Friendly USA. The 95 hospitals enrolled in Empower have now all participated in site visits led by coaching dyads that are comprised of experts in lactation management and quality improvement science. And there are, a lot of progress being made there. Also, an update in terms of our community-based organization work. In December of 2015, NACHO, the National Association for City and County Health Officers, awarded funding to 9 local health departments to provide peer and professional support in the vicinity of a hospital that was selected to work on the Empower project that I just mentioned. And those 9 newly funded local health departments are Florida, Lee County, Sarasota County, and Broward County; Georgia, Coastal Health District, Gwinnett County; Michigan, Kent County; Ohio, Elmira City Health District; Tennessee, Shelby County; and Maryland, Family League of Baltimore. And then one other update in terms of the CDC surveillance of breastfeeding rates. As many of you know, CDC breastfeeding rates come from the National Immunization Survey, which is managed by CDC's Immunization Services Division. Each year, the new survey data are available to us in our group for analysis around June, so that we can put out our rates for World Breastfeeding Week and add those to the report card on years that we have a breastfeeding report card. We don't have a final answer, but due to changes in the survey management of the National Immunization Survey and possible new restrictions in data access, which are still being discussed, it may not be possible to have the data in time to release breastfeeding rates for August. So we will keep everyone posted on that. And finally, the Maternity Practices and Infant Nutrition and Care Survey is in the field, the 2015 survey, and it closes March 1st. Thank you.
Thank you, Kelly. Big updates from CDC and very, very useful and timely. We do know that we've had questions from coalitions asking if the MPINC survey is still on, so this is good to know. And thank you. So with that, that brings us to the end of today's session. A big thank you to Kim and Andrea for teaching us the vital role of community again. And many, many thanks to all of you who improved the lives of women, children, and families. We hope very much that the 222 webinars brings you ideas for collaborative action. Please complete the webinar evaluation and let us know how we are doing. Your suggestions are very valuable, and it helps us bring you topics that are relevant to you. You also get a certificate of attendance when you complete the evaluation. So goodbye for now